This is the Thriving Dentist Show with Gary Takis, where we help you develop your ideal dental practice, one that provides personal, professional, and financial satisfaction.
Welcome to another episode of the Thriving Dentist Show. I'm Gary Takis, your podcast co-host. We have a great episode for you today. We're going to talk about team member retention today. And I have a longtime colleague and friend as a guest on the show, Janice Hurley. Hey, Janice, how are you?
I'm good, Gary. I'm really good.
You know, you and I did a little bit of a pre-recording discussion about our topic today. And I could hardly think of a more perfect topic for the podcast than team member retention today.
It's on everyone's mind, isn't it?
It's a different world, isn't it?
It is.
It is. It is. It's a very different world these days. And it's important that our listeners pivot and adjust to the employment world that we have today. And I want to go on record as saying, and Janice, I'd love to hear your thoughts on it. I want to go on record as saying there are absolutely things that dentists can do to enhance team member retention.
100%.
Yeah, you can have some control over this. Of course, certain turnover is unavoidable. If someone moves out of state,
yes,
that happens. If a young mother decides to be a stay-at-home mom, we celebrate that, right? Isn't it great that the family was such that mom could be at home for the kids, but that might result in a loss of a team member. So a certain amount of turnover is beyond our control, but much of it is within our control.
I agree. I agree.
There's things we can do to create team member retention. With that short opening, Janice, many of our listeners will recognize you, recognize your voice and also your name. You've been on the show in the past a number of times. Always love having you as a guest on the show. But we'll have some new listeners that maybe are not familiar with you or your work. Would you be kind enough to share a little bit of a background to help our listeners understand who you are and why they should pay attention?
Sure, absolutely. So I've been a practice management consultant for the last 34 years. Love dentistry. Started out actually in medicine, helped hospitals retain their physicians. They were in rural areas. They'd spend all this money to recruit, a lot like we do with hygienists sometimes or associates now. And they would put them on a 2-year contract where they paid for everything. And at the end of the 2 years, they were hoping, of course, these new doctors would stay, and they didn't. So they brought me in at the very beginning to help teach them scheduling, staff retention, et cetera. And as medicine started to go more managed care, I moved into dentistry. So that's a kind of an interesting dynamic, right? Because what was it, about 10 years after that, we were strongly affected in dentistry by the high influx of insurance. So right now, I work throughout the United States in office with clients and enjoy that very much, whether it's general dentist or specialist. And I tend to work with private practices. So my largest practice has 48 team members, 2 host doctors, but I also work with the more traditional dentists that you and I were used to at the very beginning, which is, the one doctor, 2 hygienists, 2 assistants, 2 administrative team members. So there's no right or wrong. It's just whatever's best for you. And then I'm very fortunate to get to coach female dentists throughout the world, actually, through Dentsply Sirona. They have a program called First to 50. They made the commitment 3 years ago that 50% of all of the speakers at their large conferences and other meetings would be female. And though more than 50%, as you and I both know, of the graduating students in dentistry are women, that wasn't represented up on the stage. And so Dentsply Sirona pays for them to have coaching training. So over 4 months' time, they have 8 remote courses on what it takes to outline their programs and not be boring from the stage. So Yeah,
Well,
I
you
love
do
what I do.
you do amazing work with
Thank
your
you.
coaching for women dentists, and I love Sorona's Dentsply Sorona's commitment to representing, accurately our profession today from the stage, from the podium. Jan, I just discovered, Janice, I discovered that you and I have something in common that I didn't know. We've known each other for a long time. But when I started in this profession in 1980, I also started working with physicians.
I didn't know that.
Yeah, the firm that I worked with had a mixed, it was a law firm that I worked for. They had a mixed client base of physicians and dentists. And at the time, they were about 70% physician, about 30% dentists. And early on in my employment, they asked me to do a white paper, do a research project, and report to the board of directors for the law firm about whether they thought the firm would be better served to focus on physicians or dentists. And I was skilled at research, so I was honored to get that assignment. And I did a 6-month exhaustive research project. This was in 1982. And I presented to the board that while both professions presented some positive attributes, I felt like dentistry was more attractive because I felt like healthcare on the physician side was going to go the way of managed care. And that most physicians would reach a point where they no longer had private practices. They'd be working for corporate medicine and for hospitals. Dentistry, on the other hand, my crystal ball said that dentistry would be affected by insurance, as of course it has. However, I felt like private practice was always going to be a viable segment within the dental profession, more likely than on the physician side. And so my recommendation to the board is that over time, we pivot and change that mix from 70% physician, 30% dentist to becoming more heavily populated by dentist clients. And that's exactly what they did. You and I kind of had a similar,
you were
similar
right.
experience. Yeah, the crystal ball turned out to be fairly accurate. Well, Jess, I want to start, if all of us recognize that COVID has impacted our profession in many, many, many ways. I will say that I feel like dentistry has navigated COVID fairly well. Given some of the background we had in dealing with creating a safe environment, for our patients. But I'd love to hear from you about what you've learned since COVID about team member retention, because I kind of feel like that represents a bit of a demarcation, kind of like there was team retention pre-COVID and now there's team retention post-COVID. I don't think it's quite that clear, but that's kind of how I feel like it. So what have you learned since COVID about team member retention?
I want to reference back the fact that what you said about many of the dental practices did really well financially during COVID. There was challenges in terms of serving patients with hygiene, et cetera, but we were already set up to understand about contamination, and there were programs that helped pay back for, there was a whole lot of practices that came out at the end doing really well, but the big divide happened in terms of the team. So I kind of put it in two different groups. One was what happened between the hygienists and the doctors. So in your mind, right, just quickly for you, what did you see and experience with the dynamics between the doctors and the hygienists?
Well, I experienced this in my own practice, that there were mixed opinions about the risks associated with COVID, and especially in the aerosol type environment. How do you deal with that? You're absolutely right, Janice, that you and I have been doing this long enough to remember when infection control was an alcohol wipe.
Totally.
However, it was really the AIDS epidemic in the early 1980s that changed all of that in dentistry, and really caused dentistry to take a close inward focus about how do we create a safe environment for patients that perhaps have AIDS? How do we create a safe environment for all of our patients? And so dentistry has a long standing tradition, but it's not fair to say that every office follows the same protocols. Even here, 40 plus years later, there's various degrees of implementation and various degrees of attention and seriousness attached to infection control. But
and then what
we saw,
happened, I'm sorry. And then what happened with COVID, though, now we had the unknown. So you and I, as consultants, would go in and make sure we were observing everything possible for the safety of our patients and the team members. But it was that element of fear that I saw happen for some of the hygienists who were worried about their kids at home, or they experienced themselves. They had family or members with COVID. So all of this dynamic started taking place. And I think what I really saw happen was that the doctors and the hygienists had to be so willing to have honest conversations, and the doctors really needed to listen to those fears and do whatever was needed to allow the hygienists to feel more comfortable, whether it was more time on the schedule. Do you remember that? When we weren't used to all the PPE that we were having to dress up with, etc. But I saw a real break in trust in some places, and you could see it on Facebook for these individual groups, hygiene groups, right? They had a safe place where they could talk, and that's where I got to see the biggest influx of animosity and distrust. And so fortunately, my clients, and I'm certainly yours, weathered that storm really well. But that was parting the curtain a little bit to see what hygienists were really thinking and feeling. And that was challenging times. With the other team members, particularly the assistants, I don't know if you saw it. I saw it the most with assistants. They figured out, because often they're young, they're female, they're of family age. They, during COVID, figured out a way to pay the bills and live on one income. And Gary, good, bad, or indifferent, I saw them figure out basic math and do the numbers for what it took to, at the same time, gas was going up, right? So they figured out what it cost them to go to and from work for childcare. And they had lived a while, maybe without that second income, or they had been able to figure out how to work from home. So for me, one of the happenings that took place with COVID in terms of staffing was we had a lot less dental assistants to choose from. I didn't see that happen as much on the administrative team, but I definitely saw it with the assistants. And I would tell you, this is probably controversial, but I don't really care. I saw that the doctors often got back the team that they deserved, meaning if they had really had a good relationship of trust and communication and support with their team before, they got the highest number of team members back. I had some others that I wasn't surprised with. They were new clients, right? We hadn't figured out some leadership skills, but they had a much lower retention rate. And devastating. The biggest change that I made after COVID, and I should have probably made it sooner, maybe you did, I didn't, okay, but my true confession, I figured out that it was all about the team, that the success of the practice was all about the team. And I had a different mindset before. I think I focused more on the skills, verbal skills, clinical skills of the doctor, marketing, et cetera, et cetera. And in some small way, I think I was complicit on the idea that staff were replaceable, right? If this didn't work out, then there would be 5 or 6 others. And so that's some of the things I learned about COVID. Is any of that in line with your
I think you're spot on, Janice. One of the things I observed in my client base was, and in my own office, also my client base, was doctors that stayed closely connected to their team during the shutdown period. And of course, we had to do that, in a compliant way. And they were doing that by Zoom and by other, video type formats. Those that stayed closely connected to their team and actually had safe environments for open discussion, especially with the hygienists, had created a safe environment for open discussion. Share your thoughts. What are your concerns? And actually listen and pay attention to that and talk about, okay, what can we do to address, those concerns, to make sure that we create a safe environment for you, for me, for our patients and all of the people that are affected by our interactions, all the families, they're affected. And those that did that typically navigated the retention a whole lot better. There are situations, Janice, and I know that this might be true for some of our listeners. It's kind of like hindsight being 2020, if you could do it all over again. But there were dentists that, they were shut down, literally had no contact with their team members until shortly before they reopened, and then sent a communication, say, oh, we're going to start back on Monday, morning huddle at 7:00, be there. And that was it.
Right.
And I'll share an underreported statistic, Janice. And it's not going to surprise you. It's not going to surprise our listeners. But there's some estimates that 25% of the hygiene workforce have left the profession. 25%.
Yep.
Have left to either pursue other careers, whatever. But they left hygiene. And that's part of what we're experiencing right now in the what is still a pretty severe shortage of hygienists, because now there's interesting dynamics that are filling that in. There's also a very underreported dynamic that there are a large number of nurses that mid and late mid-career are making decisions to change careers, leave nursing, go back to school and become trained as a hygienist and work as a hygienist. And there's three primary reasons for that. Number one, much of nursing today involves pushing paper instead of taking care of patients. And these are nurses that want to be involved in patient care. Number two, you got to love our hours in dentistry.
I was going to say that is first. I didn't know that. Yeah. I would have said that was first.
Well, I'm not numbering them in order, so it could be first. But another reason would be that nursing could be 24-hour shifts and different shift work. Well, largely in dentistry, we were daytime hours, Monday through Friday, maybe Monday through Thursday, maybe Friday, rarely evenings, rarely weekends. And all of a sudden that presents a very favorable work schedule to a nurse that has been subjected to some odd hours. And then the third reason is, although you and I both know personally many wonderful physicians, I know that you have many physician friends. I have many physician friends.
Or family members.
Some of them.
Or family.
Yeah, and you have family members. Okay.
Yeah.
And the truth is there are some wonderful physicians, but there are some that are not so much. And largely, dentists are more enjoyable to work with. And for those three reasons, nurses mid and late mid-career are going back they're putting their career on hold for 2 years to go to school to graduate, with a hygiene degree and plan to spend the remainder of their career working in hygiene. Now, we're going to see the benefits of that coming up.
I love it.
There'll be a pipeline coming in, but we're not there yet because they're still involved in school. There was some effort to try to see if there's any way you could shorten the 2-year degree to be shorter than that because of their past background in healthcare.
Sure.
But unfortunately, because of the practical part of the job, it still is a 2-year training. So we're going to see the benefit of that. But to recap here on that first question, you and I have really been an interesting seat at the table from very different perspectives. We approach things differently, but have wonderful compatibility in terms of philosophy and approach. And I would wholeheartedly agree with what you said. A world-class practice requires a high-performance team. Absolutely requires. You don't get one without the other. They have to be lockstep together, and you and I are in complete agreement on that. So let me head a little different way. If any of our listeners are afraid of losing a team member, because I have to think that that's on almost every dentist's mind, where do they start? Where could they start to be proactive about that and perhaps create an environment where someone doesn't want to leave.
Yeah. This is often the reason that a doctor will call me and want to do one-on-one coaching, consulting for leadership. And in the conversation, I really do try to find out how long they have felt that way and listen to what the team member has said or done that communicates that. And my first response is usually the fact that they don't want to make decisions from a position of weakness, that always you want to make those really important decisions when you feel good about yourself, you feel good about the practice and the patient base and what you have to offer. But a lot of people don't get leadership training, do they, when they're in right? Or maybe they haven't had a whole lot of other leadership role models or work experience, but functioning from a position of fear is actually the worst place to be. And as they're talking about the present situation, and we dig deeper, we can see or hear that it's actually been fairly long-standing. By the time they call me or reach out, they're functioning, daily. Gary, there are dentists who dread seeing their team or walking in the door because they feel like it's one of animosity, and that's just the worst thing. So the best advice I can give is you have everything to offer the right person for you. I wouldn't be too surprised if you'd made unknowingly some mistakes along the way that created this environment, because I'm a big believer in the fact that you train other people how to treat you. And if you're in a position of fear that someone will leave you, that means the other person chose to create that environment, and that supposition serves them well. And then there's some work to do.
Yeah, absolutely. And I think, the idea of creating an environment where we attract and keep the best team members is so critical for us today. Let me get very specific with you, Janice. I'm going to share with you a discussion that I literally had yesterday with one of my clients. And I'd love to hear your thoughts about this, because I would suspect that my response and what we'll hear is your response are probably going to be very compatible. But one of my clients called me yesterday and said, Gary, I haven't experienced turnover recently, but when I go to my study club and I hear from my colleagues, a lot of them have. And I realize that, turnover is something that is an issue in our profession today. And he said, I really have started to poke my head around, especially with hygienists, and I've discovered that hygiene wages are increasing based on supply and demand. Should I give my hygienist a raise? So here's the question. I think I'm a little bit low based on what I've discovered. I didn't think so, but then I went out and got some information. And I got the information from my accounting firm, who happens to work with a lot of dental practices. So it wasn't just rumor and innuendo, but it was actually factual data. And I believe I'm under the radar of what an appropriate wage would be for a hygienist today. Should I be proactive about this and grant raises, or should I wait till they ask? That was the specific question that was asked. So I'll put you on the spot. Is it okay if I put you on the spot, Janice?
Absolutely.
Okay.
Of course, I want to hear your answer, but I'm going to have my own.
I want to hear yours. Go ahead.
Okay. All right. I am going to take the risk that we might not be in alignment, but I'm going to bet that we are. All right. So I'm all about being proactive. So much so that I had a client in Somerville, Tennessee, amazing practice. But before I went, and I started there actually by doing one-on-one leadership coaching with the female dentist, but I asked for a review, of course, of the overhead of personnel expenses, et cetera, just like you do. And you want to see how long it's been since somebody had a raise, employed, et cetera. And of course, in hygiene, we look to see what each is producing. And when I looked at what hygienists were making, one of the first things I addressed with them is that they're underpaid. And their response was, well, they haven't asked for a raise. And my response was, they're underpaid. Okay. Now, because they didn't have systems in place, perhaps they weren't producing what we needed them to produce, right? Which is at least 3 times what their daily wages. But as I told the doctors, I can fix that. I can increase what they produce. But what we can't do is after the fact, right? By the time somebody comes to you asking for a raise, specifically in an industry like hygiene, where everybody knows what each other is making, then I've missed that opportunity. So we raised the wages of the hygienists, and we instituted having a lunch, because these hygienists were actually working 9-hour days, trying to with no lunch, and to try and make up for, you know, a salary that was too low. So yeah, be informed about what's in your area. Be empathetic about cost of living. One of the thoughts was, well, nobody makes that much money in Tennessee. I mean, the minimum wage is $8 in Tennessee. And I'm like, I don't care. I pull up the wages, and it definitely got the hygienist's attention. So am I in a line with you or close?
Well, I actually knew this was a very low risk discussion, because I knew we'd be completely aligned. We've known each other for a long time.
Long time.
My advice for my client, and first of all, he was armed with information. He had information, because a lot of the discussion about, you know, what hygienists make are, you know, it's simply
hyperbole. It's not
hyperbole, not backed by data, but
emotionally based. Somebody's upset. Yeah.
Well, and I want to give credit where credit was due here. My client was, their accounting firm was a member of the ADCPA, the Academy of Dental CPAs. And this particular accounting firm works with over 450 dental practices, many in their state, so they could gather the information relative to the practice. And now he was armed with information. And the other piece that I was armed with as their coach, I knew their numbers. I knew where their overhead was. I knew that there was room for a raise in the budget. And my advice was exactly, be proactive about it and provide the raise. I mean, we don't want to lose a really quality team member, you know, over a few dollars an hour. And I don't mean to say that in a cavalier way. But the numbers are important. The budget is important, but you can have your total team wages in the appropriate percentage and have very well paid team members. And those goals are not mutually exclusive. You can get both of them. And you illustrate that, you know, in your answer, because, hey, if we're going to give a raise, then we've got to figure out a way to help our hygienists become more productive, you know, to justify that raise. But I would absolutely be proactive in this marketplace, because the last thing in the world I think any of our listeners would want to have happen is a really good hygienist come to the doctor and say, hey, doc, I've been offered a lot more money somewhere else, and I'm going to take it. By then you're behind the curve.
Can I talk about the way to give a raise also?
Please.
Okay. So besides being proactive, this particular practice had 4 hygienists, and they said, do we just give it across the board? And I said, well, you can, I mean, in terms of what the actual daily rate or hourly rate would be, but bring them in one at a time and talk about the things that they have done so well and what they've contributed to the practice. And before you've even talked about money, talk about that. And then ask them, is there anything you would want me to know that would help you enjoy your work more every day? So you have to set this up an hour time, give time. Don't have it just show up in their paycheck, which I've, you know, watched clients do before, and listen to them. And then at the end of that, say, I want to let you know that we're raising and you're worth every bit of it. Absolutely. But making it personalized. Here's the time not to give a raise to a hygienist. And that's someone that is causing trouble amongst the rest of the team by being negative. And there's no way that giving them a raise would stop them from being unhappy here. So that's a very different thing. Yeah. And then, not to go too long-winded on this, but I don't think giving a raise will ever make up for if a team member feels unappreciated. So they need both. But the question specifically was about hygienists and their fee schedule or salaries that we give them. So props to you.
Very good points. I'll add one more discussion point here. I've noticed in my client base that many of my clients have been very successful hiring hygienists in particular who responded to, say, an Indeed ad or a dentalpost.net ad. And there's someone that wanted to leave. They're currently working in a corporate environment, and they're looking for a private practice.
Yes.
And I want to be clear that they're all corporate environments are not the same, nor are all private practices the same. But what we were hearing from a lot of hygienists, we'd hear something like this. Hygienists would say, I really love my doctor or doctors in my office. I enjoy my team members. I enjoy working with a great team.
Love my patients.
I love my patients. The love, it was usually, I love my patients,
yeah.
But I just don't like the corporate environment where it's all about numbers. And I'm looking for pivoting over to private practice. I might suggest that they can be awesome team members, because hopefully when they land in your office, it's like, I found my dental home. This is where I want to, spend my career working for an office like this. And so that can be to your advantage. We've seen a lot of that happen, especially in hygiene.
Yep.
The other comment that I want to make, especially relative to hygiene, is everyone listening to this podcast knows how I feel about insurance. And my goal is to help dentists reduce their insurance dependence, not
100%.
necessarily go fee for service, but reduce it. And I know,
100%.
Janice, you feel similarly with me on that. And I will tell you that today, with hygiene wages escalating and reimbursements going down from PPO plans, in many cases, it's often untenable. There are states, especially California, that hygienists, the office is not even getting enough reimbursement from the insurance company to pay the hourly rate of the hygienist, let alone all the other costs associated with it.
You're right.
The room, the supplies, the infection control, the admin support to keep the schedule full in hygiene. They're not even getting enough reimbursement to cover the hygienist hourly wages. If that's the case, then you really need to take a look at successfully resigning from certain plans where that isn't the case. And that's another discussion for another day, but let me put that in there.
Right.
Now, let me pivot our discussion. And let's deal with this from a positive perspective. Let's say for a minute that an office is growing and they're thriving and they have a need for an addition. We're not replacing someone, we're adding. What are some, in fact, maybe what is the biggest hiring mistake that you see in your work?
Yes, it's usually waiting too long, hiring or starting to look for someone else from a position of being desperate. I have literally heard doctors say to me, I hired her because I was desperate. And I'm like, oh, please, please, please. How much time, energy, and money has it cost you because you hired that person?
I got a pulse in the interview, so I hired that person.
I was so glad they showed up and et cetera. And so one of the biggest mistakes we make, let's start, I'll give you my top three. One is that we don't do a good job writing the ad. So now in this digital age, we get to write beautiful ads. It's not the old yellow pages that you and I
remember. We used to get charged by the word line, or the character, and all the ads were a shorthand where you had to be a genius to understand.
That's right.
What
I forgot about that. Yeah, abbreviations. So now you need to write your ad from a position of what the applicant is reading, right? So please stop saying such things as we're looking for hardworking, patient-oriented, blah, 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 blah. Everybody says that they're those things. Instead, let the person know, particularly hygienists. Let's say you're going to write an ad for a hygienist. You should talk about the fact that they get an hour per patient, that they're perio classified ahead of time, or whatever the case might be, if you use a laser, but put it in terms of what they would be looking for. Don't make the focus just about the money. And then once you do get a chance to speak with them, let's say we're talking about administrative team members. All you have to do is listen to them on the phone, and that should help you make the determination. Do they have the proper voice, tone, pace, right? Because you will not be able to change their grammar. In women, the higher the voice tone, the more the patient at the other end thinks they just got the high school girl that's, paid for over the weekend or vacation time to answer the phone. And so don't be afraid to be very specific on what position responsibilities this person will be encountering and what personality traits are you looking for. So hire from a position, again, of strength. It's good to ask your other team members if they know someone, but don't be afraid to run an ad. Some older practices have said to me, well, you just get the, the not so good people if you run an ad. And I'm like, no,
the job hoppers, the ones that are hopping around.
Yeah. So common mistakes. And the third one is always, to me, you don't ask specific enough questions. Can I give you a short example?
Please.
I have an office in Seattle. They have 48 team members, and they seem to be always looking for somebody new. So that's why I'm there, to try and put that to a stop. But they recently hired a treatment coordinator. And when I spoke with her just yesterday, actually on a Zoom call, and I asked what she liked about the idea of being a treatment coordinator, et cetera, and what success she'd had in the past, within less than 60 seconds, she let me know that what really worked was don't present big treatment plans, don't present anything their insurance won't cover. And my eyes were this big, right? So that's entirely counterproductive to what I think somebody presenting treatment should do. And but no one had asked her those questions. No one had said, what have you found works in presenting treatment? What's your philosophy in terms of involvement in insurance? What type of visual aids worked when you were presenting treatment? So a big mistake, I think, we tend to have that interview trying to sell the practice and the benefits of coming versus just asking questions, saying, what was it like? What worked? Which
I love your open-ended
programs?
I love the open-ended nature of your questions, in that you really now you arm yourself to get lots of useful information by asking open-ended questions. One of the ones question I like at the end of the interview, toward the end of the interview, is to say something like this. If I was interviewing you, Janice, we might say, Janice, as you might imagine, we've had a lot of people interested in this position. Of course, we're interested in you. That's why we're having this discussion today. But I'd like to ask a very direct question. Is that okay, Janice?
Sure.
Why should we hire you? And then we pause. And one of the reasons I like that question is I'm actually looking for a couple different things. I'm looking for an answer that would, directly answer that question, but I'm also looking for some confidence in the question. And so partly I'm looking for, in the reply, I should say, I'm looking for their quickness at replying to that. And doing a bit of a self-assessment of, here's why I think I might be a good fit. And that's not a generic one we ask every time, but that's one that I think could be added to your list of questions when you're interviewing. How do you feel about that question?
I don't like it, and it's okay, but
no, I'd love to hear your thoughts.
But we usually agree on 90% of it.
Sure.
Why should we hire you just leaves it on kind of a note. All right. So that's my opinion. But I have a different one, if I can interject that. And it's in the right time in the interview. If I like this person, right, I'll say, take a minute to read over the specific job responsibilities. And then I give them time, right? Or I've sent it to them ahead of time, because we might be doing a Zoom call. And what I might ask instead would be something like, so when you read those duties or responsibilities, or you envision your day, give me one or two that are going to be a really good fit for you. This is something about the job that you really like to do. So then if I asked you that, you would give me an answer to, I love treatment presentation, right? And then I get to ask, well, what specifically?
Very cool.
It's when they answer the question, gives me more permission to ask a little bit more specific, dig a little deeper, and I never contradict them. I'm just listening to what they think that job would involve. But
I love that approach, and that's a great idea to share whether it be job description, job duties, share that with them. A great way to really go into a little bit of depth about where you feel like their strengths are. Great.
I do have a personal question that I ask people that maybe you wouldn't agree with, but hey, we got a little bit of give and take here. I like to ask the question, who in your life most affected your work ethics? Who would you say that person is? Now, I'm looking for two things. Do they know what the word or the phrase, those two words, work ethics, mean? And the other one is, I get to see insight into their values, and they talk about their mom, their grandmother, their dad who got up early, or whatever the case might be. So yeah.
Well, I like that.
Oh, okay. All right.
Very
It
cool.
works. It's kind of cool.
Yeah. Well, we've talked a lot about the whole team retention concept, but I've got a great question to ask here, and I want to focus this more on the dentist, on our dentists.
Yeah.
What are the characteristics of dentists that you've noticed that have high team retention? What are their characteristics?
Yeah. You know how you have great authors, Simon Sinek or Malcolm Gladwell. If they want to talk about successful people, they hang out with successful people or interview successful people. And over my years, many years of working, it was a good learning experience for me to sit back and say, long before COVID, who's really good at keeping the team? And there were some traits that came out. And one of them was, many times they had been in the military. They had a leadership role as a dentist in the military. And they had been very comfortable with standard operating procedures, the leadership role of being clear about what was expected. So the three traits that I talk to my doctors about, and then the first one is, don't be afraid to be clear. If the morning huddle is at 8 and you want everyone to be there at 7:45, you're clear about that. That's very different than be on time for the morning huddle, right? 8 o'clock morning huddle, but what time do you expect them to enter the building and be ready?
That could be interpreted different ways.
And it often is, right? So many times the communications between the doctor and the staff are subjective when they say, I want a full schedule, or I don't want to run late, or none of that it is helpful in terms of getting them to accomplish what your goals were. And then the second one is being consistent, no matter whatever it is that you ask for. Don't feel apologetic about it. I had an oral surgeon up in Yuba City, 5 different offices, had amazing team members and team retention. And it surprised me because when I read his employee guidelines, they were strict before strict was even, in style. And I couldn't figure out at first why he had, such good retention and quality people. So one of the first ones was, he attracted quality people because everybody knew what to expect. He was consistent about what he did, and he didn't play favorites. So sometimes our doctors get themselves in trouble. They will get a negative review, a negative report, and you know who the top person gets negative reviews. It's an administrative team member. It's across the board. And they'll ignore that because they don't want to lose that person, because they think that person knows everybody in the town, and without her, I'm nobody. So they're not consistent with the way they treat their assistants. They're not consistent in the benefits. They don't address the little things. So yeah, I tell my doctors, I'm sure you say the same thing. Everybody knows this. You praise in public, right? And then if there's anything you don't like, don't let it build up. You have a conversation. It's just as simple as a conversation. It's not a confrontation. Right. It's just, let's say that you have a team member that doesn't show up for the morning huddle on time. The first time they don't show up on time, I ask, them to come in my office or sit down with me, and I say, "Are you okay?" Because it's not like you to not be on time. And they're going to give whatever answer they have. But it's always posed as a question. It's just an open-ended question. Are you okay? And then if they have got some flaky reason, or semi-flaky, my next response is going to be, so what do you want to do differently then so you can be here at 8? What's going to work for you? So it's not adversarial, but I often see my clients, and I think yours might be the same, because a lot of our doctors don't like what they consider to be confrontation. They'll let it build up. And then by the time they speak about it, it's in a negative manner.
And it's a confusing message because it's been allowed, and then now it has to be addressed. Okay, I was keeping count on those 3 traits. Number 1, be clear. Number 2, be consistent. What's number 3?
Oh, be confident. Be a confident person. We are drawn towards people with confidence. And confidence just means you have good self-esteem, and self-esteem has to do with what you're telling yourself as you do things. And we're drawn towards people that we don't perceive as being needy or functioning from a position of always constantly reassuring. So do those, as a good leader, as a good doctor, do those things in your life that make you feel confident and good about yourself. Do those things that align with your value system. If your value system is that you take time and energy for your spouse, then great, give yourself support for that. So being wimpy, being needy, being weak, being constantly apologetic, not a good leadership.
Not so much.
Not so much.
Can I add one?
Yeah, for sure.
You probably know this, Janice, but our listeners may not. The largest generational group today, in our population is no longer baby boomers. Our generation, Janice, they're no longer our generation.
Nope.
They are the millennials.
Yes.
In fact, it was 2021 when millennials replaced the baby boomers as the largest population group. And while it's dangerous to paint a brush across any generational group, you have to be careful about that. And I want to recognize that. One of the positive traits about millennials is that they love to be associated with something that's bigger than themselves.
Yes.
They love to have purpose. And so I would add a 4th trait, and that is be a visionary. Be a visionary. Communicate in a way with your team members that your team members know what you're about, what the practice is about. Is it truly about changing the lives of others? And how do you model that? How do you show that? How do you as a dentist show up for that and model what you expect of your team members? But I found that millennials, although I think that any member of a generational group could respond, to the visionary concept. But millennials in particular are interested in that because they want to be involved in something that's bigger than themselves. And that could be your dental practice. But what does that sound like? What does it look like? What modeling do you have to provide that you want to provide as an example of what you expect from your team members?
You're absolutely right. Although you and I know that part of our role is to help the financial aspect of the practice, and we look at numbers and monitor all of those key factors, it matters to each team member that what their role is important, and that you can't get by without them, and that they interacted and made someone else's life better. And so I will often in a team meeting surprise anybody that's there, but go to their computers as a group and ask them to pull up a patient whose life they changed, and let's look at to go through the whole treatment. What did they say was important to them on the phone slip? And then what did their comprehensive exam look like after that? And what did they move forward on? And letting the clinical team see that it's really, truly not all about the doctor. It really is about the patient. And they can feel important and celebrate that and celebrate that. Yeah, you're absolutely right.
One of the things I teach my clients to do at the end of the morning huddle, and imagine that, most of our clients are pretty sophisticated when it comes to technology. We have a flat screen monitor up on the screen. in the workroom that has the schedule up, and we
Don't you
ask
love
everyone
that?
to look.
Don't you love that change in
Oh, I love
our
that.
work environment?
It's
Yeah.
right there.
Yeah.
So I want everyone to take a look at today's schedule and look at the particular people that we're going to see today. And then we ask a question. I'd like nominations from you as to this question: whose life are we going to change today? Look at the people that are on the schedule. Could be something clinically. It could be something behaviorally. Maybe we know that someone has experienced some hardship recently. We want to show an extra dose of empathy to them. Could be a celebration. Maybe we know that a particular patient on the schedule is about to have their 25th anniversary next week, and we're going to celebrate that. But we get very intentional about whose life are we going to change
Love
today?
that.
What does that
Love
look
that.
like?
Love it.
Kind of a fun way to end the morning huddle and send us out, in a positive way.
I
Well,
love
Janice,
that. Can I
as
steal that, Gary? Can I steal that?
absolutely,
Okay,
absolutely.
good.
You have my
Yeah.
permission to borrow that. You bet. Janice, as I expected, this has been a blast. I know all of our listeners are going to walk away with things they can apply today in their practice. And I want to invite you back. It's been too long since we've had you on the podcast.
I know, the time flies by.
So I have, and you have some future topics I think we could talk about. So is it okay if I have you come back?
That'd be great.
In the meantime, I want to know, I want our listeners to know how they can reach you. As I mentioned, Janice and I have been friends and colleagues for many years. She mentions that she is a coach. She's an in-office coach. She actually travels to offices and does in-office coaching. I know with your location on the West Coast, you prefer clients that are west of the Mississippi. Is that a fair geography for you?
That's very fair, very accurate with today's travel challenges. That's a choice, yeah.
And I know you enjoy, as you mentioned earlier, you enjoy working with women dentists on leadership. Mm-hmm. And I imagine that can be done remotely. Is that correct? So
absolutely.
you can expand geographic boundaries through your remote work. And if anyone wants to reach you, they can do what we all do when we want information today. They can Google you, Janice Hurley, and they'll find out your different social media channels and where they can reach out to you. One thing I want to comment on, I know that you have an amazing collection of positive 5-star reviews on Google.
It's embarrassing. It's embarrassing.
Well, but I'll talk about it then.
Okay.
So I'll talk about it. So you have an amazing number of 5-star reviews. So as a listener, I want you to go through, just Google Janice Hurley, and you'll see her reviews. Read through some of those. And you'll find out the amazing difference she makes in the lives of her clients. And let me encourage you to reach out to her. Janice, thank you so much for this interview, and thank you for sharing your wisdom. And I love the fact that we don't agree on everything.
Pretty much. We're pretty close.
We're pretty close. Philosophically, we're very close.
Yeah.
But I love the fact that I think collectively, when you put our input together, 1 + 1 = 4.
I think so. Oh, that's good. I like that.
Well, on that note, I want to conclude by thanking our listeners. We appreciate each and every one of you on the Thriving Dentist Show. Thank you for the privilege of your time. I look forward to connecting with you on the next Thriving Dentist Show.